Rhinoplasty, or nose job that some people call it, is a surgery to enhance your facial harmony and the proportions of your nose and your face. It reshapes your nose to improve the aesthetic, and in some patients it can also be used to improve your breathing through your nose at the same time. A good candidate for rhinoplasty or nose job is someone who wants to improve the shape of their nose, the width of their nose, improve the profile of their nose to get rid of the bump, or overall enhance the symmetry and the harmony of their nose to the rest of their face. It can also be used to fix a deformity after maybe you've gotten into an accident, and it can also be used to help with breathing through your nose at the same time. People who are a good candidate for rhinoplasty surgery or nose job are people who want to improve the overall harmony and shape of their nose related to their face, people who want to decrease the width of their nose, improve the profile to get rid of any bump on their nose, and also to refine the tip and the shape of their nose to have a more refined aesthetic look, and also people who need to improve their breathing at the same time. So there are different kinds of rhinoplasty, and there's different approaches. You can perform an open rhinoplasty or a closed rhinoplasty. A closed rhinoplasty is less invasive with no incision on the outside, no scars that are visible. And an open rhinoplasty, in some patients where we have to do a little bit more work on the inside, in order to access it and to really help us shape the nose, we make a tiny little incision on the skin on the outside. That scar usually heals very well and is almost imperceptible. A rhinoplasty procedure takes anywhere from 2 to 3 hours. The recovery, you go home the same day, you'll have some bruising on your face and usually a splint on the outside that you can't go out in public with. But you'll feel fine after about 1 week. You come back to the office, we take off the splint, we take out any stitches, and by that time you can go back to your normal activities, you can go back to work, you just can't play any sports or any strenuous physical activity for a few weeks. In our practice, for patients who are getting rhinoplasty, we always use 3D photography and virtual surgical imaging so that we can review the plan for the surgery and show the results three-dimensionally on the computer screen before surgery and make sure that our vision for what you need in rhinoplasty is in line with your vision, and we can address the areas of concern so that we know what to expect after surgery.